Hello, it's me, Dr. Toomer, and it's Dr. Toomer Talks on Tuesday, although it can be any day, but today just happens to be Tuesday. So thank you for joining. If you're here, say hello. If you're joining later and watching later, just say hashtag replay. And I'm really excited because I have Dr. Panico here, who is a rheumatologist. And as many of you have done, you always ask me a lot of questions about joint pain. And I often get a lot of people who are motivated to come see me for their weight health journey because of their joint pain, low back pain, and the like. And so I am so excited for her to be here because I really want to talk about how do we know when to see somebody when it's serious? How do we know if it's just your normal aches and pains of getting old, which many of us are, or when is it time to actually make an appointment? But I'm going to let her introduce herself because, as you know, I always bumble through people's introductions. So the best way to do it is just to let you do it yourself. So thank you so much for coming. And
Yes, thank you, Dr. Toomer.
yes,
So I'm Brittany Panico. I'm a board certified rheumatologist, and I practice in Gilbert, Phoenix, one of the suburbs of Phoenix, Arizona. And I've been practicing now about 10 years in rheumatology. I was in Chicago before Phoenix. So I have a private practice, Summit Rheumatology, and we treat patients across the whole state of Arizona. So I have my little pocket of local patients, and then we do a lot of telemedicine. So one of the things that, we can kind of segue really easily as well when you have something, specific or a condition where you're trying to evaluate, an autoimmune disease, for example, but telemedicine actually does work pretty well in rheumatology. So that's kind of one of the cool things that I'm trying to expand is just like how rheumatologists can get better at telemedicine to help more patients. So yeah, I'm really excited to talk about joint pain, however this conversation goes. So
okay.
happy to be
Well,
here.
first, I'd like to say hello to my aunt Cynthia. Thank you for joining. And so really, so I mean, people say my knees hurt, my back hurts, my feet hurt because I know gout is something that when you have it, you know it, and it's not
Yes.
subtle. But what about the things that are a little more subtle? Like, how do we know when it's time to actually see someone, as opposed to being just normal aging, wear and tear, or even if it is normal wear and tear, when do we seek help?
Right, exactly. So that question is kind of broad. And the reason I say that is because my kind of the best way I can impart this on to a patient is if you feel that there's something wrong, it's better to seek help than to hide from it because we don't necessarily know that there isn't anything abnormal until we go try to find out what that thing is. So let's say, for example, knee pain, right? If you are in the process of trying to lose weight or thinking about, does my weight make a difference, right? Even the question of like, my knees hurt, what's happening? If we can establish either through x-rays or a physical exam or some evaluation that you either have osteoarthritis, so wear and tear degenerative arthritis, or maybe a tendinitis or a mechanical issue causing your pain or symptoms, or you have swelling, for example, right? Sometimes it's really hard to tell, do I have swelling of my knee? But it hurts to bend, it hurts to bear weight, it hurts to be active on that joint. So really just getting your foot through the door is the first step, or, telemedicine wise, right? Like setting up that appointment to be evaluated and have somebody actually look at the joint to see, does this look normal or does it look like there might be something else going on? So I think if you feel that there's something wrong, it's more helpful to be evaluated. The caveat with that is when we are told as patients that nothing is wrong or that it's just arthritis, right? Let's say you go and have your visit and your doctor says, oh, it's arthritis and losing weight will help you feel better. That can be a really discouraging answer to the question that you're trying to ask. So when do you then seek additional help, or when might you seek a second opinion? And that courage to be told that something isn't really wrong, but you in your body feel that something's wrong is a little bit challenging to overcome. But I do encourage you to keep seeking help until somebody can show you why they're saying that it's just arthritis or that it is something else. We as rheumatologists will often sit down with you and show you either what your x-ray report says and go through it together, what your lab work shows, or images if we can. So it's really valuable to ask, okay, you're telling me this, but why are you telling me this? Why are you saying that it's this diagnosis?
Yeah.
Because then we can explain, okay, this entity, right, swelling versus something that's not swollen may mean one thing versus degenerative or wear and tear arthritis means this. So that's one, way to get started. The other side of that answer is if you notice you have swelling, there's something like your joint is red and swollen and hot. You mentioned gout. It's typically we can tell when there's swelling in that joint. So if you have a joint that's swollen or a joint that you can't bend, that you could a few days or potentially weeks before, or your mobility has dramatically changed. There's something called polymyalgia rheumatica, where it's a very fast onset of very intense inflammation that you can't necessarily raise your arms up overhead or get up from a seated position. So people will really struggle, and they'll have been, quote unquote, functioning normal potentially days before. So that's something to get help for.
Right.
So those kind of things, right, where it's like a dramatic change from your baseline, from your what has been your normal, to get help sooner.
And that makes sense. And I think that one of the issues you did bring up, which is very, very helpful, is that sometimes people get discouraged when, when they see a doctor and a doctor says, well, losing weight will help. And I was one of those people who was told that as well in an earlier life. But for any physicians who are out there, because I do have quite a few physicians listening, so anyone out there, just keep in mind that even if weight contributes, it's still important to address whatever the complaint is at that moment. And if pain is that moment, it doesn't matter if you need to lose weight will help with the pain. They're still in pain at that moment and they want help at that moment. And so that's really important to keep in mind.
And one thing that I tell patients too, who come to me and say, well, I saw somebody and they said, I need to lose weight. Then circling back to, okay, well, how can we help you be more active so that it doesn't hurt so much to try to move your body? So even if walking to the mailbox down your driveway is your goal, your starting goal, how can we help decrease your discomfort so you can get to that point? Then you can start going, a little bit farther, a little bit farther, a little bit farther once you're feeling better. So as much as we don't necessarily prefer certain types of medications with other issues, let's say diabetes, high blood pressure, you name it, if there's a reason not to be on something, we can use them for a very short period of time with monitoring and help the person get started, right? Just like with weight loss, we want to help sort of kickstart that process.
Yes.
Then once you feel better, you're more inclined to start being more active and moving your body, and you feel the result of, I feel better when I do this. Or on the opposite side of that spectrum, this really bothers me and I'm not feeling better even though I'm trying. So I do think that, again, you touched on the point of, okay, well, let's be helpful, right? Even if there's a reason not to be on something long-term, 3 months, 6 months, whatever, if we tried something for a week or two, just to get the body moving, that's still a possibility.
And so, because one of the things that we often think of many times when joint pain, back pain, whatever, we consider it sort of like an old person's issue. However, any of us who are in our 50s who don't feel all that old,
even younger than that.
so then I have a question. How do we prevent then having some of the issues? What are some of the ways that we can help protect our joints when we are younger, so that because even though I'm 58 now, my mother's 93, I could easily have another 30-40 years to so what do I do now to protect myself from as I get older, and others how they get when they get older?
So that's a great question. And taking care of our body is really the best answer for that. And I say that with the the mindset of we can't undo the past all the way. If you have an injury, let's say, for example, you broke a bone, right? We can't change that. But taking care of that body part or that joint moving forward, we can. So, meaning not putting yourself at high risk for things that then lead to injury. So, right, athletes, professional athletes have guaranteed osteoarthritis, just the impact of that lifestyle, right? Construction workers, people who do very manual labor jobs have more wear and tear on their body. So, ways that we can help then prevent damage from happening is, and again, not to bring everything back to weight, but you are, a weight loss guru. So really having a healthy body weight, and that can fluctuate. That doesn't mean that you are thin your entire life, but it means that your frame is not carrying around excess weight that puts strain on your load bearing joints. So if you had an injury to a knee and then you are now 100 pounds overweight, that injury, that arthritis from that injury is going to be compounded on that joint. Versus if you had an injury and you're at an appropriate BMI, your load bearing weight on that joint isn't going to be excessive. It's going to be normal, what that joint was made to do. Other things is utilizing low impact activity. So impact, again, thinking about athletes, for example, or runners or skiers or people who have a lot of impact on the joint. Those activities are completely fine, and exercise is encouraged. But if you get to a certain point that you're doing those activities and now you're feeling pain, that's your body's signal to say, maybe this isn't the best thing for me to continue to do over and over and over. So modifying your activity to do things with less impact, a certain portion of your exercise journey, versus then trading off impact exercise. So it's very unlikely that we can do CrossFit, right, for 20 years every single day. Our body just isn't really meant to do that. So we have to sort of balance stretching and strengthening, strength training, and impact versus low impact activity. And then also recognizing if you feel like there are certain triggers. So a lot of the buzz these days is, how does my diet affect my joints or the way that I feel? So if you feel that you have triggers, for some people it can be dairy, for some people it can be sugar, for some people it can be, certain types of, acid containing things, right? Like if we feel that we have a certain trigger, salt, for example, then decreasing those trigger foods to help us feel better. And the feeling that we get from that is not necessarily in the joint itself. It's not the bone and the cartilage, but the tendon and the support system around that joint. So we can get irritation around the joint that we then feel stiff from. So that's kind of one way. So really it's minimizing injury is the biggest thing. And then also taking into account the load that joint is going to carry over the course of time. And again, if you have a period where for 5, 10, 15 years, your body was a little bit heavier, that's okay. But changing the course of that over time is helpful.
Yes. And as I've mentioned, and I think others have pretty much a rule of thumb, when you lose 1 pound, you lose 5 pounds off of your load bearing joints. But we have a question, and the question is, what are your thoughts about exercises like squats and lunges and knee health?
So as long as the activity isn't triggering pain. So there's the difference between like discomfort, like stiffness and discomfort, right? From your thighs burning from doing squats, right? The muscle versus joint pain where your knee feels like it's going to give out when you do a squat or lunge. So if you're not in pain doing an activity, then those are strengthening. You're strengthening. The stiffness that comes after the activity is normal muscle-induced exercise, kind of stiffness and recovery. So as long as it's not causing you to either fall, be off balance and fall and potentially injure yourself, then as a rheumatologist, I like to encourage my patients to do those exercises. Sometimes too, we get nervous of a way something feels. And so then we stop ourselves before we actually get to the point that we're strengthening. So if you're thinking about squats, for example, if you do 5 squats, you're not specifically strengthening your muscles and your support around the joint. Versus if you work your way up and do 5 more every day till you get to a point where you feel the tension in that exercise, that's going to lead to strengthening. So there's activity that, again, if we're doing it for the purpose of being active and keeping our body strong versus I'm just doing this to sort of say that I'm doing it and get my number in and say, that I do squats, that isn't necessarily going to help your body be stronger, but you are being active, you're trying, right? It's all that mindset of, am I moving myself forward to a goal? Does doing this amount of activity then help me to be able to be more flexible and get out of a chair more confidently and things like that? So there's kind of like rehab versus,
Yes.
working towards a goal.
I understand. And so then the question is, are there supplements or things that we can do along with those activities that will help with joints, or is that just more of a myth? How do you feel about some of the cartilage building, like collagen and all the others, in terms of helping with joints and joint health?
So if you feel like it helps you feel better, then they can be helpful, meaning like turmeric and collagen supplements, glucosamine. I have some patients who think they really do help, and they sort of keep the joint. The idea is that they keep the joint lubricated and you're not as like stiff. They don't help with injury recovery specifically or bone rebuilding. So if you have, again, going back to an injury or an inflamed joint, if you have rheumatoid arthritis or psoriatic arthritis or gout, for example, and you're taking them to help supplement what a medication would do, they don't serve that purpose. But for osteoarthritis, they can be helpful in alleviating that stiff feeling that we have. Okay. But again, they're not necessarily prescription regulated, meaning we don't fully know what we're ingesting each time we purchase that bottle of supplement. So to not necessarily rely on that as your sole solution for your joint discomfort, but they can be helpful in some people. I also don't necessarily encourage them because it can get very expensive to be caught up in the supplement world of things, just like right with diet pills, right? It gets very expensive and it's unregulated. So if you want to dabble in it, by all means, I think, again, they can be helpful. But if you're going to devote a percentage of your income every month to something like that, that might not be proven to help you in the long run, just maybe think about what that means, for you individually.
Or the personal trainer then.
Yes. You'd be much more beneficial to, again, work on strengthening that joint or that area and maintaining a healthy weight than focusing on just taking the supplement. Yeah. And water, we really neglect the value of water. I notice just in my day-to-day working, when things get busy and I'm not staying hydrated, I'm relying on caffeine more than water, and I feel more stiff. I have a harder time typing. My knees feel a little creaky. So there really is something to be said of keeping our body hydrated, because our joints need that hydration too, and not getting dehydrated to the point that, again, we're sort of shriveled up on the inside. I know it's kind of a metaphor, but if we're not hydrated, the whole process of lubrication doesn't work very well. So water is super important. If you have a condition where you have to limit your water intake, again, just being mindful of what that means. But water is super important.
Well, we have Dr. Una saying that Dr. Toomer got me on drinking water. So
yes. In Arizona, we all walk around with our water bottles. I mean, I have one everywhere I go, and it's just a thing. But there's the image of I'm walking around with it versus I'm actually drinking it.
So before we go, I do have one quick question. So when it comes to being younger and um, in our diet and how we can help supplement in ways with our diet too. So I always tell people, really focus a lot on your calcium and your vitamin D,
Yes.
because that helps with your joints, it helps with your bones. And if you don't have a good skeleton structure, nothing else you're going to do later is going to make a difference.
Right.
Is that good advice? I
Yes.
just Okay.
Yes. The way that we treat our bones when we're younger, meaning premenopausal for women and around the same age, younger than 50 for men, is how our bones are going to age over time. Meaning we take good care of our body and our body will reward us. So really focusing on good calcium intake, vitamin D intake, measuring your levels. I'm really diligent about following my patients' vitamin D levels. Not only because is it important for bone, but it's also an important vitamin for immune system function, skin, really everything, muscle health, all of the above need vitamin D. So being, diligent about that. And then also the way that our bones sort of remodel over time, being aware that after menopause, then we start losing more than we're building. So we don't feel osteoporosis, which is thinning of the bones, but we're more likely to have an injury in bones that are thin versus bones that are firm and appropriately dense. So if you want to avoid arthritis, again, as we age, taking good care of your bones as we're younger is definitely, helpful for sure.
Well, we have Dr. Una who said that she doesn't take vitamin D. She was so bad about drinking her water before. Well,
Hopefully we've convinced her now that it's important.
We're going to
Yes,
talk.
her 90-year-old self, right? We kind of joke, in healthcare, like, what is our future self going to think about what we're doing to our body now?
Yes.
And I think for joints, it's really hard to realize that impact because we just sort of go on and live our lives and, I might be achy or creaky now, but what does that mean, in the future? And really, again, not to bring everything back to weight, but it does come back to that. Having a good support structure that your body can hold up and be mobile and, do the things that we are asking of our body really comes from taking care of ourselves. And that is in the form of eating good food. Again, drinking water, getting enough sleep, doing all those things that take care of ourselves so that we, can live that energetic and fulfilled life, staying active and doing things as we age.
And just so you know, I mean, and people know this about me, and I say it over and over and again, I am very adamant about not shaming people in weight loss in any process at all. And in medicine, we do sometimes have a tendency to shame people into changing or scaring them into changing.
Yeah.
But just to keep in mind that even as we talk about joint health, even when losing weight, everything doesn't have to happen at once.
Yes,
and they're
exactly.
done in increments. It can be done in small increments so that you don't get overwhelmed, so that your body doesn't object to what you're doing, because the last thing you want to do is to get an injury, and then it just derails the whole process.
Right.
And so and Dr. Una did say, she said, I'll behave, I promise. I know you will. I need vitamin D supplement recommendations. So what I recommend for vitamin D supplement, you want it to be D3, body absorbs it better than D2. The other is, I prefer the prescription of the vitamin D3. And the reason is, if it's FDA monitored, you know that in that pill has the actual amount it says it does.
Yes.
If it's a supplement, supplements are not regulated, and any amount can be in any pill.
Right.
So D3 prescribed by your physician, preferably 50,000 IUs, international units, a week.
Yes.
But anything, really if you can get a 5,000 IU bill a day, then that's still 35, in the week. So it's still very, very helpful. And one of the beautiful things about vitamin D supplementation is that it works. It really does your levels, and we're not in the sun enough, which is where we normally get our vitamin D. We're just not in the sun long enough. Really. Well, maybe in Arizona you might be,
but we wear sunscreen, right? So even my patients, I thought moving from Chicago to Arizona, vitamin D is my number one prescription. As a rheumatologist, I prescribe that by far more than any other product that I recommend.
Yeah.
And it's universal. We're not out in the sun because we're told not to be, but then we use sunscreen when we are. And different skin tones absorb the sun
Different.
UVB rays differently. So we can't universally say every person needs this amount of sun exposure, because that was never proven against different skin tones, against different altitudes, against all of those factors come into play. Air pollution, you name it, right?
Yeah.
Season, all of that. So, right, my best suggestion is to have a doctor or your healthcare person check your level to find out where you stand in the value of that range, and then prescribe one for you.
And I can tell you, in the almost 25 years in medicine, I've only seen 2 normal levels, and both of those were in people who are already taking vitamin D. So, yeah, almost everyone is
It is
low.
super common, and not a lot of people are paying attention to it, believe it or not. So
Yeah.
even if you ask for it, it's still valuable. It's not something automatically primary cares are checking. So you often have to ask, can I have my vitamin D level checked?
Absolutely.
Yeah.
Although it is helpful now with vitamin D being added to milk and now orange juice, it's better, but it's still not regulated. It's still considered a supplement, so there's really no way of knowing exactly how much is in there. Well,
Exactly.
I just want to reiterate that we're getting close to the 30-minute mark, but I just wanted to say, you are in Arizona. You said that you treat people all over the state through telehealth and locally. What about anyone outside of Arizona? Is there any way for someone to at least follow your information, contact you in some way, or if someone wants to refer to someone in Arizona, how will they find you?
Sure, exactly. So my website is Summit Rheumatology, so SUMMIT rheumatology.com. I do have the ability to work outside of the state of Arizona. However, it's a limited basis. So you can certainly contact me if you're outside of Arizona. But the best way is to find me on my website. We have a contact us page that pops right up right at the beginning. So you can fill out that little questionnaire and then get in touch that way. Or that's probably the easiest way, is through the website. And then on there, we have our office phone and information as well. I'm also on Facebook, Instagram, LinkedIn. Dr. Brittany Panico is my Facebook. I have my Summit Rheumatology page too, but I also have Dr. Brittany Panico on Facebook. So you can contact me that way also.
And I'll put all of that in the post.
Perfect. Yes. And I welcome questions. I'm more than happy to at least give you suggestions on questions to ask your doctor. A lot of times it's just identifying how do I open that door? How do I even get started? Right. Yeah. So even just something as simple as, again, asking your doctor to check your vitamin D level is a helpful way to start that conversation of, being proactive and getting yourself feeling better.
Yes. Well, thank you so much for joining me. And I just want to
thank you.
Just joined us again, Dawn and Tamara or Tamara. I always mixing up her name. I'm sorry. I'm so bad with names. I really need to do better. And Dr. Una and Chris, and of course my Aunt Cynthia, and Dr. McStuffins, which is Natalie. I already know. Thank you for coming.
And awesome. So many people are joining us. So
going up and saying hello today. So they said, Dr. McStuffin does say, since prescribed D3 isn't vegan, do you recommend a specific vegan-friendly vitamin D source? I don't, but I will, because now I'm going to look. I'll find one.
And you can ask your pharmacist too. There's different tablets versus capsules. So I think if you ask your pharmacist that you'd prefer something vegan, they can help you sort through that.
Yeah, it is. And I think, because mostly I think they're like from fish sourced. So, but there's definitely it's an oil-based vitamin, so there has to be
compounding pharmacies. I work with a compounding pharmacy local who I know will again kind of have different formulations available. So that's a great question, and the answer is yes. There are places that do it, and usually starting with your pharmacist is helpful.
Okay. Yeah. All right. Well, one of the things I'll do is I'll get that information and I'll add it to this post, because the vitamin D question seems to be a popular one. So I'll make sure that everyone knows, and I'll probably end up doing a post on it. So,
yeah. Yeah.
Well,
Awesome.
thank you again, Dr.
Thank
Panico.
you. Thank you.
This has been
Yeah.
really informative, very, very helpful, and I very
Awesome.
much appreciate you coming on.
Thank you. And thank you, everyone.
Good night. And this is always the part where I have some issues because I can never turn this off easily. There we go.